Good day, and welcome to Our Planet, Our Health, a program of conversations with Montanans from across our state who are working to help protect our health, our ecosystems, and our lands in the interest of others. I'm Rob Byron, an internal medicine specialist who practiced in southern Montana for many decades. I'm joined today by Dr. Larry McEvoy. Larry trained as an ER physician, but has been a CEO, an innovator, an entrepreneur, and is now leads an author as well of Epidemic Leadership. Larry, welcome.
Hey Rob, good to be here again. First time we've ever had a conversation in a studio, many over the phone in the middle of the night about patients, but this is a first for us both.
And welcome. And Larry, we'll talk about your credentials a little more in a minute, but before that, let's help us to learn a little more about you.
Yeah.
Where did you grow up and what was it like?
Well, I grew up in the bustling metropolis of Clancy, Montana. If you've been to Clancy recently, you know it's gotten quite busy, kind of a bedroom community of Helena. It was a real small town when I grew up in the early 70s, mid 70s. And my folks had a little place up in a canyon in the Elkhorn, so I was a lucky Montana kid. I was outside most of the time, rain or shine, winter or summer. Went to school in Helena High, and grew up in a family that, you know, like a lot of Montanans, we hunted, we hiked, we had a big garden, had chickens. My mom and dad were into teaching their kids to work hard, so we had a lot of chores every hour before school and last thing I did at night. So that's how I grew up, and you know, Helena was a great town to grow up in as well in those days, and still like going to Helena. So that was it. I was an Elkhorn Mountain kid that went to school in Helena, and life was pretty simple back then. Went fishing, went hunting, loved Montana.
Right. And the reasons that many of us still like to be in Montana.
Exactly.
It's so moving on from there, we went to school.
Yeah, I was, you know, in that time in Montana, our economy wasn't very good. I like to say Montana then was kind of beautiful, poor, and not sexy, right? And in the intervening years, we've kind of become a place that people come to, right? A lot of tourism comes into the state, a lot of money comes into the state, a lot of big houses on the top of some big hills. In those days, you know, if you had a chance to get a job, a lot of people left. They ended up in Seattle or Portland, whatever. So I thought, you know, I've always liked making things healthy or seeing things be healthy. So, and I had a dad who was a physician who had me in and out of hospitals and nursing homes on holidays. Really, I can't remember the first time I ever did that. So I thought, you know, I'm going to go become a doctor, I'll come back. That was my idea. It was pretty simple at that time. There were no med schools in Montana at the time. The WWAMI program was up, so you could go to the University of Washington and, you know, then go to Bozeman for a couple of years. But I went away to school, like a lot of people do. Turned into a doctor, turned into an emergency physician, and can talk about that in a second, and came back. And again, life was kind of that simple. I liked the place I lived, I liked the people I lived with, I liked the country I lived in, the land I lived on, and I just wanted to come back and help out. And that happened for a while.
Okay. Thank you. Well, let's talk a little bit about that, being an emergency physician.
Yeah.
I mean, that's most of us get our emergency physician exposure from ER.
Right. Right. Yeah.
And
well, my wife always says I'm a pain to watch ER with or any of those emergency shows because I sit there and I edit and I roll my eye. Oh, that wouldn't happen. No, you can't do that. No, that's too quick. No, hold on. So she shushes me and chases me out of the room when shows like that come on. But I guess what's interesting to me about emergency medicine is that a couple things happen that maybe people don't always realize. I hope the people watching aren't in ERs too often for their sake, and I hope if you were, things went well. We see what happens when things unravel. I always like to say no one ever got up to come see me or the team I was working with because they wanted to, right? We're always a bad accident, right? We're a car wreck, we're a slip on the ice, we're a heart attack, a bleed to your head, a cutting your thumb when you're making dinner, whatever. No one wants to come see us. The downside of that, or what we see as a result of that, is we see things we can help with, which is really, really gratifying. Hey, we can fix this, we can patch you up, you can go right back to your life, off you go. It's very rewarding. And people are appreciative, right, to get back to the dinner party where they're chopping onions for dinner or whatever, to get back to their job, get back to their families, back to their ranch. And that is really, really gratifying. We also see how things fall apart and how you can't put Humpty Dumpty back together again. We see a lot of chaos. We kind of become disaster artists. And for me, Rob, one of the things I noticed was that, I guess two things I'd mention. One was how many layers go into health, right? You can have really normal blood pressure, and as a doctor I'm saying, yeah, that's great. But it's not that as you turn and see the cholesterol's out of whack, or the blood sugar's out of whack, or your skin's in trouble, or maybe your bowel's not healthy, or your neurological system's breaking down. So health isn't just within a person, it's around a person. And we figure out pretty quick that the healthier environment people are in, the greater and greater probability that they're going to be healthy, which is true in many ways, right? So the healthier economy we're in, the better chance you're gonna have a good job. The better educational support we have in a society, the more people are likely to get education that they need in life, whether it's basic education or higher education. So we start to see these layers in the ER, and we start to see how they peel apart. And the frustrating thing in the emergency department is you can't put those layers back together right then. We get to be kind of experts in what happens when you tear the layers up or peel them apart, but we can't fix that as easy as we can suture a wound or put an aortic graft in or pull a clot of a coronary artery. That stuff we're pretty good at. But this longer term unraveling, we get a front row view of what it looks like, but you can't fix it there.
Yeah, thank you. That's a wonderful point, or a couple points. And let me just emphasize one thing you said, which is for particularly our younger physicians now, it's very much a part of their training that some of those outside forces, for example, whether you have a good job, is one of the most important things as to your health, plain and simple. And there are multiple others, often called social determinants of health, which is now part and parcel of being a physician or a nurse or any other healthcare professional. And that's an important concept that many of us had to learn on our own.
Yeah, and the hard way,
And learn the hard way and had to figure it out. So
I guess the thing I'd like to add about that too, because I think for our listeners, sometimes you hear these terms like other medical jargon, and you're like, what are these geeky doctors talking about? So our job, I think, one of the things I liked about the emergency department was I had the chance to talk to ranchers, plumbers, accountants, tax attorneys, single moms, kindergartners, people in nursing homes. You have to talk to everybody and think about how they understand things. I didn't ever meet anybody who said, Doc, I would really like to be unhealthy. Can you make that happen? I met people who were frustrated, in despair, hopeless, didn't think they were going to make it, but I never had anybody say to me, I don't want to be healthy. And what's interesting about the structural determinants of health and some of these more systemic environmental factors that we've learned about is that this is not just jargon. We've got loads of science about it now, decades of science, and we're not done. We're finding out more and more and more that if you put these layers together, the probability of health, not just at the indicator level, right, where we're looking at scorecards or data, but at the community level, right, a whole family or a whole neighborhood or a whole zip code or a whole state like Montana, you can optimize the chance. And this shouldn't surprise anyone, really. It's this idea that we see in stock markets, right, that a rising tide lifts all boats. And it's better to invest in a market that's going up no matter what the stock or the mutual fund is, rather than hope to be a genius when the market's going down and you find the one or two lucky things. So can people be healthy? With a lot of effort and a lot of personal investment, they can optimize their individual chances. But if you really want people to be healthy, the individual, the family, the neighborhood, the community, the state, they all got to be working together along these layers.
Okay, perfect. I appreciate that. So let's take it back to you then. So you're working in the ER.
Yeah.
And then I know that you had several leadership positions, and you've done even more. So fill us in a little bit to your journey through these systems, shall we say.
I got, I suppose, what they call bigger and bigger jobs. And, in the world of healthcare, there are sort of two schools of thought about that. One is that maybe you can help connect the dots and make the whole thing work a little bit better for the people that really count. And under people that really count, I would say the people delivering the care, working together night and day, weekends, holidays, et cetera, and the people, patients and families who need the care to go well. Those are the two main stakeholders I was really interested in early in my career. And when I was young, I just tried to be a good doctor. And I know hundreds of doctors and nurses and techs and pharmacists, and that was their sworn commitment to be really good at their job. And what bugged me as I tried to do that with my colleagues and teammates was that no matter how hard we tried, this river of unhealth kept coming in the door, and it was bigger and wider and stronger than we could handle. So you could scramble and paddle and swim like mad, and you couldn't get upstream, and it kept washing over us. And the other thing that I noticed was that out of my position as a clinician, I couldn't get healthcare to work as well as I wanted it to, either as a doctor or a teammate, or I've been a patient myself. My family, like most families, has had medical issues over the years, extended and near, and I couldn't help them as much either. So I thought, well, I got to get upstream on this. So I was a department chair of our emergency medicine department for a while, and then I was basically what was the chief medical officer, and then I was a CEO of a health system in Colorado, what was then Colorado's largest trauma center. And what was interesting to me about that, and some people said, why would you stop being a doctor and go be an administrator? I really found that I liked going to work and helping lots of people be able to do a better job, feel better about the job they did, and start getting energetic about, hey, how can we do it better? Again, for the way we work, how can we make it a better job, a better place to work? How can we make it better care for the people that come here? How can we start interacting with people about what health looks like? I actually found that really enjoying. There were a lot of headaches to the job, don't get me wrong. I mean, I think my first day of being a CEO down in Colorado was during the big 2008 economic collapse. And I was responsible for about $320 million of what they called dead auction rate bonds. And I was like, the dead part I get. Auction rate bonds, I'm supposed to fix $320 million. I mean, there was all sorts of stuff that wouldn't have been where I chose to spend my time. But you know, when you're an ER doctor, you go to work where the bleeding is, right? So I learned a lot of stuff, but what I really liked was watching literally thousands of people go from, you know, we can't do this, or it's not that important, or we've tried this and it won't work, to yeah, we can. And we can not only do it well, we can get more and more creative and more enthusiastic about the next things that we could do. I found that really, really exciting, and I guess that's what I enjoy doing in life. I like going to situations that are going down, leveling them off, which you don't do by yourself. There are no magic wands, and I don't have a Superman cape. And getting people to say, wait a minute, let's not just tolerate this, let's address it, and let's not just address it, let's make it really healthy again.
Thank you. And that's a good segue to talk about what is epidemic leadership.
Yeah.
And I'm gonna also put a plug in here of this is kind of leads us to the topic of today's conversation, which is renewing people, places, and health. Is there a difference?
Yeah. I don't know whether to start with land or the book or my job there, but I guess I'll start with what I was struggling with. Like a lot of doctors or a lot of other people that maybe want to make a difference, and there are loads of them. And Montana, I think, has always been really blessed with just a huge number of really great people. They'll help you if your house burns down, they'll take you in, they'll do whatever they need to, right? That's the environment that I grew up in and that I was happy to be part of. I found as an individual physician, I was working so hard, and no matter how hard I worked, it was like bailing out the ocean, right? There was always more to learn. It's kind of like being a parent, right? When do you say to yourself, I am the perfect parent? Never, right? You're always getting better. And then when your kids leave, you're like, kind of this list of things I'd like to talk to you about, that maybe there were some oopses there and maybe some things I wish I'd thought about sooner, and you hope that they go on and do it a little bit better than you do. And I thought leadership was like that. I was fortunate to have a lot of resources, poured into me to become a good leader, and I took that seriously. But especially when I was a CEO, I looked around and we had thousands of people, and we had people with enormous contributive capability everywhere, and we weren't using them. We were telling them kind of to sit down and shut up, or you don't have this box on a chart, or you haven't been here long enough, or you have this skill set, but we need to fix all this complicated stuff over here. And what I really found was, and I don't get any genius points for this, a lot of people understand this probably a lot sooner than I did, we need everybody. And interesting things started happening in these environments that weren't so good when I got there, and they started leveling off and then getting healthier. We started surprising ourselves with how healthy they were getting, how good the performance was, how people were starting to learn, the kind of energy that was coming in. And we looked around like, well, how is this happening? And I even had some people wander in my office as if I had done this, like by saying, I'm the CEO, so go make this happen. Life doesn't work that way. And they're like, how is this happening? And what I realized was that I was cheating, and we were starting to cheat from what I would call the world of biology. So if you look at the lingo in business or education or even politics these days, we use words like agile, innovation, sustainability, resilience. These are part of a very popular strategic vocabulary we have about where we're trying to go and how to get there and what we're looking for. Those are all biological words. Rocks are not resilient. They last a long time, but they're not resilient, right? Rocks are not agile. They can tumble down a hill and hit you in the head, but they're more inert. And if you think about what's under those words, it's the operating system of living things, biology. And I realized the way I was thinking about healing an organization, again, not unilaterally, but I was in a position of leadership to help people have this conversation. We were starting to use techniques that bacteria use to overwhelm the body, or that cancer uses to overwhelm us. We think of those as negative things, but if you flip the script a little bit, you say these little things create big effects. And they don't start with any money, any status. They've got no social media following. They've got no consultants. They have no passports. They have no access to anything except the ability to get into your system and start tickling you so that you fall apart. And I thought, that's kind of interesting. We're sort of using this techniques kind of to doctor this place, right? Whether it's a team or a part of the organization, or the whole organization. At the same time, we bought some beat up land in Montana, west of Billings in 1996, and it had really not been treated very well for a number of decades. And you could tell, the sort of doctor lens was the water's not good, the soil's not good, the grassland's not good, the timber's not good, the weeds are going crazy, junk all over the place. And frankly, people I think thought my wife and I were crazy for buying it. But we started watching it come back. And we realized that in any community, whether it's the land or an organization or a team or a city or a state, there's a ton of wealth of talent and skill and will in those places. And so for me, leadership became far less telling people what to do because I know, because I'm a doctor and I'm the CEO and I have all this genius. And instead saying, how do we find what's in here that already wants to be going in the right direction? And how do we create the connections and the tools and the momentum so that we can get the stuff off the list, right? Fix the debt, right? Fix the risk. Make this a good place to work. Make sure our quality numbers go up. Make sure that patients like it here. Those are all good things. But sometimes what's at us is bigger than the list. And if you want to get it bigger at the list, you have to be epidemic in what you do, right? You have to be exponential. And I think a lot of people realize we live in a time where whether it's just getting through your day or managing your email, let alone the big things we have going on around economics and politics and education and sort of civic unity and the environment, we've got like big chunk issues to deal with, right? So this little ER doctor says, maybe trying these by yourself doesn't work as well as thinking, how would biology do this? And biology creates swarms, biology creates communities, and it creates momentum, and then it gets going.
Thank you for that. And also thank you for the first time in my entire life I've ever talked about Epidemic in a positive way.
Yeah. No, well, that's me too, right? They're always bad. We're always trying to stop them.
Always bad.
I thought, what if they really carry a load, right? They carry what we doctors call a pathogen, right? And so measles, the disease, is the explosion in your body of a viral pathogen. It's just a little packet. So I started thinking, what if the little packet is a positive thing and you just go boom with something that's positive? And so I geek out about that these days.
Yeah. And Larry, we've talked, and I know you share your ideas, expertise, however you want to carry it, with lots of people as a consultant and with CEOs and others, but you also do it with you and your wife with the work you're doing on your land.
Yeah.
And tell us a little about that.
Well, again, I said a few sentences ago, we bought a piece of land, like a lot of people do in Montana, right? And we were interested in always, like a lot of people in Montana, how can we be part of the solution for the future? How can we make our land healthier? And the land being healthy is good, but nobody noticing and nobody enjoying it, knowing, appreciating it doesn't make a lot of sense. So we like to have, especially young people, right, kids, but families out there, certainly for fun, right? We've had Easter egg hunts over the years and things like that, but we also like to engage them in stuff we do around whether it's weed control or restoring our stream banks and you know, getting native plants back together, ripping up old, you know, dumps and junkyards. And you know, it's funny, my wife, who may or may not be watching this, kind of like, Larry, why would people come do this, right? I mean, why would they come do our work for us? And what we found is that it's not like a Tom Sawyer paint the fence thing. People just love to get outside in Montana. And this spring's a great example. I mean, we're having a spectacular Montana spring, right? I mean, you look at the place that we are all lucky enough to live in, and again, I don't know if I've ever met anybody that says, I hate looking at Montana when it's green and beautiful. So we find when people are out there, it's fun. They meet people. My wife is absolutely killer at baking and killer at a lot of things. She makes pies and cookies, and we all have fun. People meet people, and then something else happens, which is there's a switch from, gee, this is a nice day, or a beautiful day, or this is fun, or it's great for the kids, to, wait a minute, there's something else here. Like, there's an idea of people and land being healthy together that's deeper than just today, isn't there? And we end up getting to these conversations about, yeah, that's true, and what if, you know, Montana, which has gone back and forth economically in terms of land use and the health of people, and you and I as doctors can cite a lot of statistics about how unhealthy Montanans are. What if we could get health driving the way we look at land and people in this state everywhere? And there's a lot of room for argument on that, right? Should we do this before that and spend money here or there? There's plenty of room for all sorts of shake, rattle, and roll about that. But what would happen if that were an epidemic in Montana? That land and people being healthy was held at every dinner table, every city council room, every vacation, right? We're obsessed about finding out more because this is so good and it's so enjoyable to be part of, and how can we roll it forward, certainly now, by and with everybody, but to generations that are gonna look back at us, right, and say, hey Dad, hey Grandpa, hey Great-Grandpa, hey Great-Great-Grandpa, what were you thinking? And if it's a good thing, how can we carry it on? And if you weren't thinking of us, why not? Where were you, ancestors, right? So it's interesting what happens when we get people out there. And it's not a didactic finger-wagging thing. We just put people on the ground, we start doing stuff, but people start asking questions, why are you doing this? Why does this make a difference? And that one thing leads to another, and away we go.
Thank you. I think you hit on one thing which is so important is, I mean, a lot of people have lost their connection with the land because they don't have the option or it's not as available to them, and helping them get that connection back. You don't have to own land to have that connection.
No.
And whether it's just being out in nature or interacting with a group like that you do or others, it's easy to, especially in Montana, but other places too. And making that connection is such a huge, huge thing.
Well, it is, and when the people hear you say that, I think they could say, well, that's a doctor talking. But a few years ago, and if you're going in, by the way, anywhere to get a checkup, a colonoscopy or something, or a scope of your stomach, you go into one of these surgical suites, look up at the ceiling, and often you'll see a cloud or feel the flowers in the ceiling. You're in a windowless room, and you're there for some procedure, and you've got a hat on and a gown, and you're not feeling like your regular self. You look up, there's a cloud, or there are flowers or birds. That's not an accident, because we have data now that shows that even if you're an urban person living in New York City or LA, when you just see pictures of beautiful land, the outdoors, your stress hormones go down, and your immune system works better, and you heal better. This has nothing to do with whether you're comfortable camping out in grizzly country or where you live. It's just, it's in our bodies because we've been connected to this ground for so long. And you're right, now we've got phones and we've got email and busy calendars, and we've got pace, but still our bodies are connected to the ground. That's where they're healthiest. And there's, I think, an interesting point of conversation to launch from that very scientifically validated reality. Whether you're an urban person or a rural country boy like me, when you are near nature, your body feels better as a starting point, not as an ending point.
Thank you. Larry, I'd like to share a quote from your book, if I may. And you said, if hope was essential, so was its scale, its staying power, and internal point of origin. Hope coming from outside, dependent on uncontrollable variables, was less durable and less actionable.
Yeah.
And I think especially now, that's important to bring up.
Yeah, and that quote goes back to my CEO days when I arrived. I arrived in an organization where people were tired, they were frustrated, they were understandably and deservedly cynical. And some of them looked to me to be the answer. And in some ways that was fair, right? I was a CEO. I mean, I'd get a PowerPoint out, I would open the top box, my job to fix it. But that quote was my conversation with myself and with literally hundreds of people. Hey, hope has to fuel us, and hope can't be naive, and it can't come from one person. I didn't have enough credibility or reservoir of hope to pour it on people like some magic thing. And when hope comes inside out, when it comes from a person or from people working together, it's stronger and it lasts longer, and I think it spreads better too. I mean, it was a lot better for a nurse talking to a nurse or a nurse talking to a doctor where I was, for that hope to spring up there, than for me to stand on a podium and say we have to have hope. Okay, great, right? Presidents can get up and say things, and orators can get up and say things, and people can say things on TV, and you know, that kind of media influence is very common these days, right? It's loud, and we've started to say maybe that's what influence is. And I guess what I found with several thousand people was that hope starts small, it starts from inside, like an epidemic. And when it starts pinging around person to person or team to team, it starts to become very rooted and very powerful, and it spreads pretty well.
Thank you. And we spend a lot of time on these conversations, usually of talking about climate change.
Yeah.
And we often say the same thing, that climate change is very much a group participation project.
It is.
And we either win together or we don't win. And it's not up to any one person, nation, government, organization, corporation. It's all of us together. So we're getting down kind of the last couple minutes here, Larry. So what are one or two ideas that you would like our audience to take away from this of our conversations that we've had today?
Well, I guess one of the things I was talking to you about before we started here was, we sometimes as humans know there are a lot of things we could do, and we even have the science to back it up. So we do have the science on climate change. Do we know all of the things that will work? No, it's a very complex challenge. Complex challenges mean you have to try a lot of different things to sort of figure out what's working. But I find myself almost thinking like a doctor about this. I saw a lot of people who were overweight or drank too much alcohol or smoked too much or didn't think their health would go away. And you and I both know when people find that health run through that hourglass, they're like, wait a minute, where did it go? I want it back. Sometimes it's too late, right? So sometimes we don't realize how valuable our health is till it starts to stream out. And our challenge as physicians wasn't to stand there and say, hey, you caused this, or too bad, or you have to lose 40 pounds and I'm right and you're not. That just doesn't work. And so if you look at what helps people start exercising or start eating better or start taking better care of their emotional and mental and spiritual health or whatever it is, they make that decision. And you say, why do they make that decision instead of a decision to have a bad habit? It's because they have an experience that makes them say, maybe I should think and feel a little bit differently about this. And usually that experience is with other people. So I think as we think about climate and addressing it, one of the things we have to do is say, how can we create conversation and experience where people say, how can we be healthy together? And what does that look like? And how do we address all the very legitimate concerns about economies and jobs and changing roles and things we have to do differently? Those are essential conversations to have. We don't have them very well until we get on the same page. We don't get on the same page until we have an experience that connects us to land and to each other. So I guess that's where I would start.
Thank you. And sounds like it all starts with a conversation.
It does.
Thank you.
Thanks for having me, Rob.